Welcome to the Dissecting Your Mind channel. Today, we will be talking about a disease that affects 10% of the global population at some point in their lives. Next, we will discuss what depression is, its symptoms, causes, and available treatments. We will also share some tips and resources for those who are struggling with this terrible disorder. Depression has been described in medical literature for thousands of years. However, it has been understood differently throughout history. In ancient Greece, depression was seen as a disease of the soul and was treated through purification and behavior change. During the Middle Ages, depression was considered a divine punishment. In the 18th century, English physician Robert Burton described depression as a disease caused by an excess of melancholy. In the 19th century, French psychiatrist Jean-Pierre Falret first described depressive disorder as a distinct mental illness. In the 20th century, psychiatrists and psychologists have developed a variety of therapies and medications to treat depression. Although much progress has been made in understanding and treating this disorder, there is still a great deal of ignorance and stigma surrounding it. But what is depression really? Depression is a mood disorder that can affect anyone. It is characterized by feelings of sadness, hopelessness, lack of energy, and decreased interest in everyday activities. It is important to note that depression is different from a temporary state of sadness, as it is a disorder that persists over time and affects both physical and emotional well-being. Symptoms of depression can vary from person to person, but some of the most common ones include persistent sadness, lack of energy, changes in appetite and sleep, difficulty concentrating, feelings of hopelessness, and thoughts of suicide. It is important to note that these symptoms should be persistent and significantly affect a person's ability to carry out their daily activities and enjoy life. Some factors that may contribute to its development include changes in levels of certain neurotransmitters in the brain, stress, traumatic events, or health issues. It has been shown that depression can be caused by a combination of biological, genetic, environmental, and psychological factors. For example, a stressful event such as the loss of a job or a relationship can trigger a depressive episode in someone who has a genetic predisposition to depression. Es importante mencionar que la depresión no es una enfermedad causada por una sola causa específica, sino más bien una combinación de factores que pueden variar de persona a persona. There are several effective treatments available for depression. Some of the most common ones include cognitive behavioral therapy, interpersonal therapy, group therapy, antidepressant medications, and electroconvulsive therapy. Next, we will briefly explain what these types of interventions are about. Cognitive behavioral therapy is a form of treatment for depression that focuses on identifying and changing negative patterns of thinking and behavior. It is based on the idea that thoughts, feelings, and behaviors are interconnected, and that negative thoughts can lead to feelings of sadness and hopelessness. The goal of cognitive behavioral therapy is to help individuals identify these negative thought patterns and replace them with more positive and realistic thoughts. It typically lasts around 20 sessions in which the therapist works with the patient to identify negative thought patterns and change them. Once these patterns have been identified, the therapist will help the patient replace them with more positive and realistic thoughts. In addition, cognitive behavioral therapy incorporates the use of relaxation techniques, stress and anxiety management techniques, and the acquisition of new skills for handling difficult situations. Exactly, patients are usually given homework assignments to practice what they learn during therapy sessions, such as keeping a journal to record negative thoughts and replacing them with more positive ones. This can help patients develop new habits and ways of thinking that can lead to lasting improvements in their mood and overall well-being. Interpersonal therapy is a form of treatment for depression that focuses on improving relationships and resolving interpersonal problems. It is based on the premise that difficulties in relationships can contribute to depression, and that improving these relationships can help alleviate symptoms. The therapist works with the patient to identify and understand how relationships affect their mood. The goal is to help the patient develop skills to improve relationships, such as effective communication, conflict management, and expressing their needs. It is especially helpful in treating depression related to interpersonal problems, such as grief, social isolation, and loneliness. Group therapy is a form of treatment in which a group of people regularly meet under the guidance of a therapist or facilitator to discuss and work on issues related to their mental health. In group therapy, members of the group share their experiences and learn from each other through discussion and exchange of ideas. Use of antidepressants. These are medications that are used to treat the symptoms of depression. They help alleviate symptoms of sadness, hopelessness, lack of energy, and decreased interest in daily activities. Additionally, they help regulate neurotransmitters that are altered in the development of this disorder. Antidepressants have been shown to be effective when used in combination with psychological therapies. In fact, the combination of these two tools is the preferred approach used today. Finally, we need to talk about electroconvulsive therapy. It treats depression and other disorders by applying a series of controlled electrical shocks to the patient's brain through electrodes placed on the head. It is mainly used in cases of depression that are resistant to other treatments. And, while it is a treatment that has proven to be safe and effective, it does have some side effects, such as headaches, nausea, and temporary confusion after the procedure. Although depression is a mood disorder that may require medical and psychological treatment, there are measures that can help reduce symptoms and improve overall well-being. Here are some tips to reduce depression. 1. Practicing sport. Regular exercise is an important way to reduce symptoms of depression. It helps to release endorphins, which are chemicals in the brain that produce a sense of well-being and relieve stress. Exercise can also help improve sleep, increase energy, and improve self-esteem. If you're not used to exercising, start with short sessions and gradually increase the amount of time and intensity of the exercise. Maintaining a healthy diet. A balanced and nutrient-rich diet can help improve mood and reduce symptoms of depression. Consuming omega-3 rich foods, such as fish, nuts, and seeds, as well as fruits and vegetables, can help reduce inflammation and improve brain health. We should avoid processed and refined foods, as they can increase inflammation and contribute to symptoms of depression. Incorporating an adequate amount of protein is essential for the proper production of serotonin, a neurotransmitter that helps regulate mood. Drinking enough water is crucial, as dehydration can contribute to depression symptoms. Edemas, establecer una rutina diaria en cuanto a horarios de comida, actividades y ejercicio también puede ayudar a crear un sentido de estructura y estabilidad en la vida cotidiana, lo que puede ser beneficioso para reducir los síntomas de depresión. In addition, establishing a routine can help to reduce stress and increase a sense of control over daily activities. This can be particularly helpful for individuals with depression who may feel overwhelmed or lacking in control. Uncertainty and chaos can exacerbate symptoms of depression, so having an established routine can provide a sense of stability and security. Setting goals can help us cope with depression as it provides a sense of purpose and increases motivation. It is important to remember that goal setting should be realistic and achievable, and it is recommended to work with a healthcare professional to tailor goals to individual needs. Reducing stress is essential for improving depression symptoms, as stress can worsen them by increasing cortisol levels in the blood, which can lead to mood deterioration. There are several relaxation techniques that can help reduce stress and improve symptoms of depression. These include meditation. Proper use of this technique helps to focus attention on the present and release negative thoughts, which can help reduce stress and improve mood. Yoga, as it combines physical exercises, breathing, and meditation, can help reduce stress and improve physical and mental well-being. Finally, and not least important, the use of deep breathing. Using this technique helps to calm the nervous system and decrease cortisol levels, which can help reduce stress and improve mood.